So, we will discuss about the contribution of Dr. James Currie, who is European hydrotherapist. His age was from 1956 to 1805. So, in his period, he could propagate the hydrotherapy and he could practice the hydrotherapy, and let us know what all the different aspects he could focus on. He is a physician from Scotland and he established a successful practice in Liverpool, England. So, that was the inpatient setup. So, he could attract the people and he could say how hydrotherapy could work. And in all his treatments, he emphasized on use of cold water, and because of many of his ideas, he was the person who could keep the base for the scientific hydrotherapy. He published a medical reports on effects of water with the title Cold and Warm as a remedy in fevers and other diseases in the year 1797. So, this medical report was the compilation of different observations which he could make, which was prevalent among the people, and which he could compile and say, see, this is the usage of cold water in these many conditions and usage of hot water or warm water in these many conditions. So, it was his first book, we can just say. Afterwards, he could write many other many other books also. He published many other books where he could give a important principle, okay, relating to hydrotherapy. That means he emphasized on cold, but still he could develop different principles which could support for his idea. So, next in 1805, he has written a book with the title Use of Hot and Cold Water in the Treatment of Fever and Other Illnesses. It was based on his own experience and based on the experiments he conducted on his patients. So, that was the difference between the first book and the next book. And along with the Jackson, he could say that the fever should be treated very, very differently when you use it, when you use the water at different temperatures. The indications for the use of water in fevers, when the fever is especially intermittent, he could summarize in 5 different points. First one is to diminish cold in cold stage, to diminish hot in hot stage, to diminish spasm of blood vessels, to support the powers of the life till the diseased associations die away from the ceasing of their causes, and to unload the bowels. So, let us see what all these 5 principles are. He could divide the fever into cold stage and hot stage. Cold stage is the stage where the body have the control about the rising of the fever. That is where body responds for the effort which is being taken for decrease of the fever. That means to say, the set point is very well controlled by the higher centers. That is what cold stage is. In what is the hot stage? The hot stage is the stage in the fever where demand is so much from for the body to produce more heat, so that there will be initiation of the heat production, but there is no chance where the higher centers will command over the production of the heat. That means the production can go on for longer and longer duration. That is considered as hot stage. Now, what he says? He says you have to treat the cold stage with the cold and treat the hot with the hot stage of the fever with the hot. That means in cold stage, since the higher centers are taking care of the heat production in the body, you can just apply some cold water, cold applications, so that the cold can absorb the excess of heat in the body, and it can help the body to decrease its temperature. That is the idea about cold in cold stage. Now, why hot in hot stage? As I already told you, the nucleus, higher centers, they are not having any control about the completion of the heat production. They initiate the heat production, there is no command over the completion of the heat production. That is where the demand created in the body is too large for the brain centers to control over the heat production process in the body. That time you have to supply the heat from the outside. That is the idea of Currie. So, he said you supply heat by applying heat on the body, so that the demand can be lessened and body can feel that more heat is being given to the body. So, there is no need of producing more and more heat. So, once the heat production process is being controlled, then you treat body with the cold water, so that heat absorption can be taking place after the cold application. So, that is how he could say very scientifically that you have to observe the stages of the fever and you have to apply accordingly. And along with that, the third principle is to diminish the spasm of the blood vessels. Here he says you need to see how body responds, and you have to see how body organ, especially when you are applying over the skin, how the skin part is being supplied with the blood, because this is the communicator of heat to the internal part and the outer part. So, when you are outer atmosphere. So, when you are treating the body, you should see that there is no spasm of the blood vessels. And when you are going on treating the body, he says you have to support the vital powers of the person. That means you should see what is the ability of the person to withstand with the treatment. Otherwise, what happens when you just concentrate on the disease process without knowing the ability of the person, then it is from the person's side, it is too long duration of the treatment, or we can just have some distressing symptoms. That is why he says you have to support the powers, vital powers in your body, and along with that he says it is very much compulsory to unload the bowels. This particular principle which he has said, it goes along with the principle of naturopathy. You know that accumulation of the toxic matter is the main cause of the disease. That is why he says you need to treat the cause also. Whatever may be the disease, we have a principle called as unity of disease and unity of cure. So, unity of disease is accumulation of the morbid matter, unity of cure is elimination. So, unloading the bowel through water, mainly by water drinking or enema, it helps to decrease the toxins in the body. That is how the fever can be treated. As I already told you, the Currie had emphasized on cold treatments, and along with that he said that cold water drinking in large quantity should be a routine. That is his principle. Cold water drinking should be in large quantity, and now we call it as Usha Panam. In the early morning we ask the person to drink boiled and cooled water. So, and even other times person has to drink 2 to 2.5 liters of water. That is very much common, you must have heard about. So, that is the principle even the Currie had emphasized on, and he said immersion could help better instead of effusion, especially when you treat the body below 70 degree Fahrenheit of temperature, especially in warm condition. He said immersion will help instead of effusion. Effusion means just pouring of water. So, immersion will help the body to cool down more deeply and more efficiently than the effusion. That is another observation of Currie. Then he said that immersion of the patient okay, should be having a particular time duration, cut-off duration. Otherwise, what happens? Otherwise, he says after immersion of the patient, he should be exposed to the cold air and body should be cooled by evaporation. So, there should be a duration which is kept for the treatment of the patient after the immersion also. So, immersion of the patient should be exposed, after the immersion of the patient, body should be exposed to the cold air and he should be cooled by evaporation. These are all his principles to treat the fever. So, these observations makes him to stand front of all the hydrotherapy practitioners who came later. Otherwise, when the scientific observation was not documented, okay, he had the courage to treat the patient and document it. That is how Currie could help in development of the hydrotherapy.